Hi guys, let's talk about prioritization based on the rule of airway safety, breathing, circulation, and disability, which is the neuro component. Prioritization is the most tested concept in NCLEX. Mastering this concept not only prepares nursing students to pass NCLEX, but also to practice safely and confidently at the bedside. If you watch my content, please support the channel by subscribing, liking, and sharing my videos. When you come across prioritization questions or questions that ask you, what is a priority? What should you do first? Think about addressing the airway safety first, and then breathing, circulation, and finally, the disability. Airway is equal to life or death. Without a patent airway, oxygen cannot reach the lungs. Breathing and circulation are irrelevant if the airway is blocked. No oxygen can enter the body. A patient choking needs airway clearance before you can assess breathing or circulation. Safety is all about preventing harm before it happens. The harm could be to the patient or to the healthcare provider. NCLEX often tests safety as a first priority because preventing harm is foundational to nursing practice. If a patient is at risk of falling, pulling out lines, or harming themselves, you must intervene before moving on to other needs like taking virals. I categorize airway and safety as priority one, basically on the same level because safety ensures that all other interventions like airway, breathing, circulation can even be addressed effectively. A good example is when a patient is coding or something happens to a patient, you have to assess if it's safe around the patient before you can even approach the patient. When a confused patient tries to climb out of bed with IV lines attached, priority is to ensure safety, prevent their fall before assessing their vitals. Breathing. After assessing airway and safety, next is breathing. Is my patient breathing? And is the pattern normal or abnormal? Are they having paradoxical respirations? Are they having intercostal restrictions or grunting in infants? After that, then you can intervene appropriately from the less invasive to most invasive intervention. For instance, if the patient is lying supine, has increased work of breathing, shortness of breath, first raise the head of the bed, then apply nasal cannula, and so forth. As you reassess, you go up to the most invasive intervention as needed. Circulation. Okay, my patient is breathing okay. Now I can assess their circulation needs. Look at the circulation in terms of issues with number one, circulation from the heart to the organs and back. Is that working? Or they have a clot somewhere and is blocking circulation? Or they have a plaque somewhere and is blocking circulation? Number two, the blood and its components like electrolytes, plasma, dehydration, hemoglobin, platelets, RBCs, coagulopathies, lack of proper circulation like in the 6Ps. Again, intervene appropriately beginning from the least invasive to the most invasive. And whatever interventions you pick, make sure it's the most effective. Don't just go for the least effective and yet it's not most effective. So make sure that it's the least invasive but it's the most effective at that point. For example, if your patient has a potassium of 5.5, okay, not it's not too high. You can give pure kiexalate, can help bring down that potassium over time. But if the patient's potassium is 6.7, you better not count on that kiexalate to do anything for you. Kiexalate will take forever to bring that potassium down. Dialysis is moderately aggressive, but how long does it take to set up the dialysis equipments? Your patient will code on you. We need something that is more aggressive like calcium gluconate and most effective. Calcium gluconate can relax the heart muscles, or you can give your patient insulin, albuterol, and dextrose cocktail, which will then very quickly push the potassium back into the cells and address the hyperkalemia faster. Basically, try to reason like what intervention is the most effective at this time? Is this something less invasive, moderately invasive, or most aggressive? The question or data provided will give you the hints that you need. Now, I'm happy my patient is safe, airway is patent, they're breathing and well perfused. Now, let me look at the disability part. This is all about the neuro, changes in mentation, level of consciousness. For example, a patient who is hypoglycemic and is restless. This is a fast and the early sign of decline in brain cell functions. Again, Depending on the how stable or unstable your patient is, you will decide what kind of intervention is warranted in that situation. Let's change gears a little bit now. There will be instances where your order of priority changes from airway, safety, breathing, circulation, then disability, to circulation first and then airway, safety, breathing, disability. NCLEX wants you to know this. Number one, if your patient is in a traumatic or life-threatening bleeding, for example, a huge motor vehicle accident involving a big artery, that patient will bleed to death in no time. The priority is to stop the bleeding, hold down onto the source of bleeding, do not let go. These patients are even transported to the hospital or to the OR with the healthcare provider still pressing down on the source of bleeding. Other instances are AAA rupture, esophageal varices rupture, and chronic alcohol use disorder. Number two, in mass disaster triage, the priority order shifts to circulation first, then airway breathing, because the goal is to save the greatest number of lives with limited resources. Rapid control of severe bleeding, that is a circulation component, comes first since uncontrolled bleeding can cause death within minutes, often faster than airway or breathing compromise. And number three, last but not least, during cardiac arrest. Guys, what's the order of events when you walk into a scene with a person or the patient lying unconscious? Pause the video and type in the comment section what would you do and in what order. First things first is to make sure the scene is safe before approaching the victim. Then check responsiveness. Tap the patient and shout, "Hey, are you okay?" Look for movement or response. If there's no movement, activate emergency response system. Call for help. Code blue. Send someone to get the AED and call 911 if you're not in a hospital facility. Then check breathing and pulse simultaneously. So you are at this point you're still assessing. You haven't intervened yet. So you are checking the breathing and pulse, which is a circulation, simultaneously together within for less than 10 seconds. You have 10 seconds to check. After that, you're taking too long. When checking breathing, look for normal breathing, like are they not gasping or agonal breathing. If you palpate the carotid to check for the pulse, the circulation. If no breathing and no pulse, that's a cardiac arrest. So, when it comes to intervention, you address the circulation first by starting chest compressions, high quality CPR. You don't go to the breathing or the airway first. Then, when the second person comes to join you, they can help you with addressing the airway. So, after compressions, open airway using the head tilt, chin lift, maneuver unless there's a neck trauma or a neck trauma is suspected. In that case, we can use the jaw thrust maneuver. That's it, guys. I know it sounds like a lot. Rewatch the video 2 or 3 times to the point where you're able to explain it to someone. I have done practice questions on prioritization. Use these concepts you've learned today and let me know if it was good enough and how much you scored. Thank you for watching and see you on the next one. Bye.